around this time, I was also experiencing a lot of friends that were suffering from these diseases like diabetes or heart disease. I had a friend that had bypass surgery. And unfortunately, they were going through these traumatic events and not really learning, what the things that I had learned. I thought everybody should know this, that if you change your diet, it can really make a difference in preventing recurrence or even reversing disease. And then so you compare the
Yeah.
carrot from the farm versus the carrot you get from the grocery store. It is mind blowing. It's so different, so much more flavorful.
Welcome to Dive into Health MD, the podcast where we explore how everyday habits shape your physical, cognitive, and financial well-being. Through conversations with physicians, scientists, and farmers, we explore how daily choices like food, movement, sleep, and mindset shape the health and life we experience, with special episodes on sourcing high-quality food ingredients. We do our best to stay up to date, and we're always open to refining our thinking as new knowledge emerges. I'm your host, Dr. Akshita Mehta. Let's dive in. Welcome, Dr. Jennifer Davis. I am so excited to have you into the Dive into Health MD podcast. So excited to chat. Before we get started, can you tell us a little bit about yourself and your background?
Sure. Thank you. I'm so happy to be here today. Thank you for inviting me. So I am a pediatrician, pediatric intensive care trained physician, and also a lifestyle medicine specialist. And what I focus on is actually helping people reverse disease using joyful medicine. I'd like to call so really the intersection of joy and healthy lifestyle, and recognizing that joy is essential to life, but also that in order to create sustainable habits, they have to be enjoyable. And life is meant to be lived and experienced with all of your senses. So I try to help people capture that and, draw that together, help people really reverse diabetes is really what I'm focused on, pre-diabetes and diabetes for women in midlife, my age, where this is like the crossroads of where we can make changes that actually sustain us and provide us with a long, healthy life, or sometimes things go the other way. So really kind of helping bridge that.
Amazing. Well, yeah, it's so great to have you on. So there's so many people who have found, I think, this area of medicine to be really valuable, but it's so far from traditional training, right? And what a lot of us got kind of going through the training process. Can you kind of walk us through your journey to joyful medicine?
Yes, it's the journey. So I became plant-based. That was kind of my entryway to lifestyle medicine. I really didn't know anything about nutrition under the biochemistry of it that you learn in medical school. I feel it's very biochemistry and, focus on calculations and understanding that the mechanisms underneath. But I became plant-based and it opened this whole world to me. I actually watched the movie Forks Over Knives when I became plant-based. And I was amazed that people were actually reversing disease using nutrition and lifestyle. And then I started to, explore that further and actually became certified in lifestyle medicine. But, around this time, I was also experiencing a lot of friends that were suffering from these diseases like diabetes or heart disease. I had a friend that had bypass surgery. And unfortunately, they were going through these traumatic events and not really learning, what the things that I had learned. I thought everybody should know this, that if you change your diet, it can really make a difference in preventing recurrence or even reversing disease. And so I started actually coaching friends on that. And that's kind of how I started. And then it's expanded from there, because now recognizing really that diabetes is epidemic, I wanted to really make a move forward that way. And I found that we have these rules and we have this information, but I found it initially when I started coaching is that people are kind of closed to it because they feel like it means they have to give up everything that they love and their daily life and everything has to change. And yes, things have to change, but the importance is recognizing that you have to really embrace the change and enjoy the change in order for it to really work, but also to be sustainable. And joy, I use joy also really because stress is another important component that we don't really address still. It's not really in the forefront, but it really has a huge effect on how we experience disease and how disease progresses and even, making it harder to manage. So that's how I reach joyful medicine. And really that's what I practice now. I believe that, that's the first thing I talk about is what does your life look like and how can we optimize.
Amazing. There's so much that you mentioned there to touch on. One of the later things that you mentioned was stress and how we don't touch on it quite as much. And I think part of the challenge there is it's not something measurable, right? We can measure heart rate, we can measure blood pressure, we can measure an A1C, we can measure blood glucose levels, but we can't measure stress. How do you talk to people about that? And I think part of the problem is it's really hard sometimes to even internally understand if we are stressed. What does that mean? What's your approach there?
Well, The way I approach it, I think people are becoming a little bit more aware of it, but they also are a little resistant to that. And the way I approach it is I say that really everybody should be doing something every day that kind of regulates their nervous system. So I say it's kind of making you resilient, better able to manage whatever stress comes your way, right? Because it's when that acute event happens, if you haven't worked on it, you haven't practiced it, then you're not really going to be able to use it effectively. So that's kind of how I approach it when people are a little bit, resistant to it. But, I think that it shows up in ways that maybe, we don't recognize. So a lot of people have disturbed sleep, and that stress is related to that. Some people have digestive issues, and that's like a big thing that people present with, even in pediatrics, abdominal pain or bloating or, just discomfort. And that really comes down to stress a lot of the time. So when I make those connections for people, then it makes them more open to it.
Amazing. Yeah, I want to touch on so many of the aspects, food and diabetes, but just kind of focusing on stress. If there's someone who feels like it may be impacting them, they're not really sure, is there a good place to start, or is there something that you like to tell people to try and do? You mentioned one thing every day. Can we
Yeah.
dissect that a little bit more?
Right. So the things I do, I call them like micro joy practices, because it really sometimes it's hard to go directly to meditation per se. So meditation is great. And I do often recommend, apps like Insight Timer or Calm or any of those, Headspace, to start with meditation. But even just simple things like, I say taking a walk in nature or looking out the window or watching birds or focusing on a flower, something that just takes you out of doing, because we're always rushing and doing, to, just being present and being aware. And that is something that everybody can relate to, and anybody can do anytime, anywhere, really. And that's what I try to focus on. I start with that and kind of build from there.
Yeah, that's great. That's stuff that I've been trying to incorporate too and try to, learn a little bit more about. For me, I think it was being more present, and trying to really pay attention to that. And that's how it was manifesting for me. I would be even just hanging out with my kids, but I would be thinking about work or business or, so many other things. It made the day much more stressful because I was carrying all the different aspects of life that I tried to juggle in every moment throughout the day. So really like piecemealing and trying to create bigger boundaries. And that's been really, really helpful, but, have seen, benefit as well. And everything that you're talking about is so interesting how it manifests, but sleep, digestion, kind of all of the above, just the way that our body functions and the way that it holds on to it, muscle tension, I feel like is another part that people talk about a lot. So really, really
Absolutely.
helpful.
Yeah, the
And
other
then,
thing when you're talking about mindfulness and you talk about that constant feeling like you have something to do or that your mind is always something else. The other thing that people always say that that they can't be mindful or can't, capture the meditation. And part of it is this idea that we're doing it wrong. And just that recognition that your mind is somewhere else is already doing it. And then if you can lean into that and just be more aware and more present, just in those moments, it builds over time. I also say the one thing I always tell people, and this really resonates, especially for us, others as women, we're always, we always feel like we have to be rushing to something else. And part of it is just taking that moment and saying, why am I rushing? And do I really have to rush? Like, what is the real emergency here? And just that also, for me, that was like a big thing. I think that, those times when you feel like, oh, I don't have time, is the most powerful time to really stop and say, wait, but I do, and that really has been powerful for me, and it's helpful, I think.
yeah, I think that ties into this almost perfectionist mindset that a lot of us
Mhm.
have, right? Every second should be perfect. If we're going to meditate, it's supposed to look a specific way or, aim for perfection. And that's not really the
Mhm.
goal here. It's just the practice, and there's no bad meditation. It's just nice to take a couple minutes for yourself. So yeah,
Right.
fantastic. You talked about a plant-based diet and seeing shifts in patients related to what they eat. So that ties in with a lot about my company, and so one thing that we're doing. So Dive into Health MD has lots of different components to it. It's very similar, lifestyle based, different lifestyle habits, kind of all encompassing on what people do to try and feel better, just enjoy life. That's really the end goal. But a big part of it is looking at food quality. So plant-based diets are things that have, been really, really helpful, but sort of despite what people want to eat, taking it a little step further beyond just what are we eating to what's the quality of the food that we're eating. But can you talk about the plant-based diet a little bit more and how you found that beneficial or how people are responding to it?
So for me, beneficial for me, actually, I went plant-based for the planet because I was worried about the planetary effects of what we eat. But I was actually started running at the time that I
Oh,
started running more longer distances, I should say, like really long distances. And I found that I was recovering so much faster and I felt
nice.
better. And I wasn't, my digestion was better, which I didn't even know I had a digestion problem, to tell you the truth, until I went plant-based and I was like, oh, wait a second, this is how I'm supposed to feel, So it was really, but that was, yeah, the initial thing for me was that, like just recognizing that I could run longer and farther and recover much faster. That was a game changer for me. I think for my patients, I don't say, that you have to be strictly plant-based. I really focus on a plant shift, like really
Mhm.
shifting how you look at things instead of, plants being the side dish, making them the main. And that is what I work on with people, because that is sometimes it's a big leap to say, oh, completely plant-based. But really everybody should be eating more fruits and vegetables, whole grains, beans, legumes, nuts, and seeds. And that's what I say, all
Yeah.
the time. You add a little bean, add some beans to your plate, at least once a day, ideally, and then build from
Yeah,
there.
same thing. Really, not aiming for perfection here, right? That doesn't have to be the goal
Exactly.
if you want to live a joyful life or live a vibrant life, but a couple of shifts, just adding a few more plants.
Hmm.
So eat whatever you were planning on eating, and maybe that's a good place to start, and then just add the plants to it,
Right.
and then still can see a whole lot of benefit. But really interesting, you feel different, right? And I think that's something that people can play with too when
Hmm.
it comes to food. So I did an elimination diet, and not something that I recommend, like doing just willy-nilly at all. And with the idea that this is a very, very, very short amount of time. But the reason I'm bringing it up is because with slowly adding foods back in, you really get an interesting sense of how food makes you feel. And what's cool is it goes so far beyond that, but it's so far beyond what we can really see on the surface level. If we're eating in a way that where our bodies just feel better and it can use it as fuel in a much better way, then yeah, we get to run faster, right? We get to build more muscle, we get to build more energy, we're sleeping better. It has this huge downstream effect beyond just the plate. And how we felt
Absolutely.
during that meal. So cool. So cool.
1000%. That's the best thing, when you help people and they're kind of skeptical about the change and you say, just add some more. And they come back and they say, oh my goodness, I have more energy. I feel better. I digest, what they say all these things that you can't, I try not to put things in, anybody's mind before they start, but have them just, gradually start to add and see how you feel. Keep track of it. See what you
Yeah.
notice. It's really powerful. Very nice.
Yeah. And the other cool thing is, I talk a lot about quality,
Mhm.
playing with the quality of the food. So when it comes to produce, this isn't, widely available absolutely anywhere. But if some people have access to a regenerative farm or produce that's coming from a farm where they're really
Right.
paying attention to the soil and the nutrients that translate into it, it is interesting to see one. A lot of people say it feels a little bit more filling, right? The plant, the salad, the whatever it is that you're eating can actually fill you up a little bit more because it is so much more nutrient dense. And then there's a fish product that I really like. And so it's a farmed fish, but they're feeding the fish a really specific diet in order to optimize the nutrients in the meat that people are then consuming. So it's farming in a totally different way. It's really for human consumption and for optimal nutritional composition. And same thing, like I can eat a really small piece of that and make the dish a lot more plant based, but I'm not missing out necessarily on the meat portion, but feel incredibly satiated. So playing with food is just kind of like a fun thing to see how it makes you
Yeah,
feel.
I absolutely say that. Yeah, that's a great thing about eating from the farm or eating something. I also say like try to eat close. If you can go to a farmer's
Yeah.
market, it tastes so much different. My kids actually work on an organic farm now. And, obviously in the winter, I live in Vermont. So in the winter, it gets a little thin. So we don't have that much left over. And then you compare, the farm tomato or the farm carrot. That's what we're talking about lately is the
Yeah.
carrot from the farm versus the carrot you get from the grocery store. It is mind blowing. It's
Yeah.
so different, so much more flavorful. So,
Yeah.
but, I also say, eat what's available. So if you're
Yes.
gonna eat, whatever. But yeah, if you have that opportunity, go to the farmer's market, meet your farmer, taste the actual produce from the farm. Whole different
So
ball.
different. And there's so
Yeah.
many reasons behind that. The varietal, so like carrots, when we grow them, it's not just a carrot, right? There's so many different kinds of carrots that you can grow. And so the things that we're growing in the grocery store, again, they're not bad. Like, please eat them
Right.
if that's what's available to you. Like, they're nutritious, they're great, they are delicious. They're grown in a certain way so that the harvest is all there at the same time, so that they can transport the carrot, so that it gets to the grocery store. So we have something to eat. That is good. That is nutritious. But what's really interesting with these much smaller regenerative farms is sometimes they're able to get into either some heirloom varieties or just different varieties. And then so for that reason, even things can taste really different. And then the soil density could be different compared to a conventional farm. And then the transport time is not that long, right?
Right.
Eating seasonally, eating locally, it just really diminishes the time that it's going from farm to when you get to eat it. So then the nutritional composition is also different for that reason. So many cool benefits if it's available to you.
Definitely.
Yeah.
Definitely, definitely. Yeah, the varietals, you say a lot of like you said, like they grow things to mass produce them when they're doing like factory farming, as opposed to the small farmers growing things so that they, number one, can be sustainable, ideally, especially when we're talking about the organic farm. They're growing things that complement each other. They're growing different varietals. They're growing, ancient things that you may not see,
Yeah.
if you don't, unless you go to this local farm. So that is absolutely, yeah, it's wonderful.
Yeah. And it's
It's a
so
great thing.
interesting to learn about the food chain, like, right, and where it comes from and how different products really
Absolutely.
can be. But it's also
Absolutely.
empowering. Definitely want to get into the metabolic stuff. Can we talk a little bit about what metabolic health really even means, especially when it comes to women?
Oof. It's many different things. I think it's, how we digest and process food, right? Ideally from the basic form energy. So I look at it as not only our, like insulin resistance, which tends to be a problem as we get into middle age, and the GLP-1 system that helps overall regulate things. It's our hormonal systems, it's our microbiome and gut health system. It all works together to actually how we process and use energy. I guess that's the simplest form of saying it.
Yeah.
And so along the lines of what I focus on is I look at insulin resistance and how we can use lifestyle to improve our insulin sensitivity and ideally reverse insulin resistance, because ultimately that is the underlying cause when we look at diabetes and a lot of the weight loss concerns we worry about in middle age and beyond are related to how our insulin functions and how energy is able to reach our tissues or not, and how our body responds when it's not able to do that properly.
Yeah, yeah, no, exactly. Yeah, before we get too far into insulin resistance, which I do want to touch on, uh, just like you're saying, metabolic health really has to do with so much more. Is there anything else that you found valuable, like lab testing wise or just testing wise, to give people a sense of how their metabolic health or how they're doing?
I mean, ideally, hemoglobin A1C is
Mm,
the one thing that looks at your blood sugar over the preceding 3 months or so, the length of red blood cells, but also
mhm.
like fasting insulin and a fasting glucose, which is going to give you an idea of whether you have insulin resistance or not.
Yeah.
I think all the other parameters are important as well, because we're finding more and more that people have, used to call it non-alcoholic fatty liver disease, but, metabolic associated fatty liver disease and elevated cholesterol, and all of these things are related. So I like to have the full picture, I guess, before I start working with patients. So looking at cholesterol levels, LPA, ApoB, inflammation as well. So high sensitivity CRP, just to look at how inflamed we are, because that really ultimately has a effect on how our body is responding to illness and how accelerated it will be. So, and then when you have that whole picture, you can better address the underlying cause and ideally work towards improving those things.
Yeah, yeah, those are some things that I've kind of been learning about recently. And then also trying to see if there's anything like gut wise that was valuable to test for. So far, I really haven't found anything, honestly, that seemed reliable or able to use clinically. I know
Right.
people are doing microbiome testing, but yeah, just wondering if there was anything else there that you found useful.
I kind of stick with the basics. I
Yeah,
know that I do have patients that do come with a lot of gut microbiome testing. I haven't found it something that's well vetted, that's,
agree.
well supported.
Yeah, I think it's an interesting area of research. I'm just not sure that it's there clinically, but always interesting to see how people are using it, or area if other people are finding it beneficial or not. So once we are able to get some of these labs and we're identifying, insulin resistance and kind of seeing some of these metabolic patterns emerge, kind of walk me through what you like to help people with, or how you're able to help people, I guess, limit progression. But then also we talked about reversal as well, which is a really cool to get a better understanding that once we develop insulin resistance, there is still so much work that we can do to see the reversal.
Right. Yeah. The once I learned about that, I feel like that should be the goal with everybody. And in fact, Lancet just came out with another study, showing the importance of focusing on remission as opposed to just management, which I think is what we're generally focused on, right? When we focus on just optimizing blood sugars instead of looking at really what's causing the insulin resistance. So, I look again at the whole picture. We do a full lifestyle evaluation looking at all the 6 pillars of lifestyle medicine. So that's food and movement and sleep and stress and substance use or exposure to toxins also, and then connection and what support systems people have and what negative systems people have that maybe need to be backed away from. And then looking at that whole picture, I do pretty detailed, review about food, because food is one of the things that we do multiple times over the course of the day. And it's one of the things that we can, really do to make a difference. Recognizing that stress may affect those food choices as well. So those kind of go hand in hand. But really looking at all of the parameters and seeing how we can optimize. So sleep, we need to 7 to 9 hours sleep a night. If our sleep is impaired, then that's going to affect our metabolism. It's going to affect our insulin resistance. It's going to affect our glucose. It's going to affect our appetite. So really sleep is important. Stress, the same. Stress affects every system in the body. It affects our gut health. It affects our sleep. It affects our mood. It affects, how we digest. So really, optimizing, working on stress and including that in the beginning, because I find that sometimes you want to go right to, changing your diet or adding a, workout regimen, but not addressing that underlying stress makes it really hard to maintain those other changes and really to initiate them even. So, and then, food, that's, the main thing that I deal with. But food, you mentioned one thing is optimizing, increasing fiber intake. I like to look at it as fiber as opposed to looking at the other macros, which I think is there's a lot of focus on upping your protein and limiting your carbs. But really, when you look at it, it's increasing your fiber intake from a variety of different types of foods. And that's really where the power is in helping stabilize your blood sugar, but also really reversing that insulin resistance, lowering your cholesterol, lowering the intracellular fat, all of those underlying mechanisms that result in insulin resistance. And the fiber is what feeds your gut microbiome. And so when you have a healthy gut microbiome, everything else in your body functions better. Again, that's another system. It should be its own system, really, when you look at it, right? It controls almost every other system in the body, our mood, our appetite, GLP-1 secretion, promotion, so all of those things. So looking at the food and how we can optimize it. I always look at what we can add and what we should focus on abundance as opposed to what you should restrict. And I think that mindset is also helpful with my patients.
Yeah. Yeah, amazing. Fiber is so interesting. And like you're saying, there are so many things that we can do to minimize symptoms that seem unrelated. Things like insomnia, things like insulin resistance. Can you walk us through a little bit about how fiber works or how that's beneficial?
So fiber is beneficial for many things. I like to talk about fiber from food. So as opposed to a fiber supplement, because that's the other way that, fiber absolutely can help just lower, blood sugar, improve your digestion and your bowel movements. But when you eat fiber from food, so those foods that are rich in fiber tend to also be rich in micronutrients and antioxidants and polyphenols and all of the things that feed our microbiome. And our microbiome ferments the fiber. So one of the things you hear a lot lately, I've heard, is we can't digest fiber. And that is true. But we have these trillions of microbes living on and in our body that do digest fiber, and they need fiber to thrive. Mm-hmm. And if our microbiome isn't thriving, then we're not thriving. So I like to look at it like, that's what I tell the children. It's like you have this little army on you and you want the army to fight for you instead of against you. So that army likes fiber. So your body ferments the fiber. You create short-chain fatty acids, which do many different things. One of them is stimulate GLP-1. They make happy hormones in your brain. They, help interact all the other systems throughout our body. So that fiber is powerful for many reasons. So
I love that analogy, the army, right? It's like help yourself a little bit. Like you have so many things. Our bodies can do incredible things. And then if we can help it and nudge it along, then we can see massive effects. And that's really cool.
That's the key. I mean, that's the other thing I would say is like our body is always trying to reach homeostasis, right? We just need to support it. That's ultimately the goal. I have to say, like, even in the intensive care, I was an intensive care doctor for all these years. And obviously in the acute stage, you have to monitor every detail, every measurement is important, and tinkering with everything is and optimizing everything is important. But, you also find that as you get out of that acute phase, right, that acute critical illness and you're in the recovery phase, you keep tinkering. And sometimes you mess with this natural process that your body's trying to do. Your body's always trying to heal. So really the
Yeah.
key is supporting, as much as you can.
Yeah, yeah. That's what all this is about,
Mhm.
right? Supporting our
Mhm.
bodies through what it's normally and kind of naturally trying
Right.
to do. Very cool. So we also talked about insulin resistance and kind of like the middle-aged female. What is happening at this time of life to where we see all of these things manifest where maybe they weren't problems before?
So many things. So when estrogen declines and estrogen affects every organ in our body, which we're learning more and more every day. But one of the things is as that trying to create that homeostasis is our body is trying to produce estrogen in other places, and that tends to be fat. So we tend to build up more fat around our mid abdomen, and that extra fat can lead to insulin resistance. So that's one thing. We also have some cortisol dysregulation as we go through menopause that compounds this problem, and it just leads to our higher risk of many things. So of insulin resistance and prediabetes and diabetes, and just have mild insulin resistance and not progress. But this is why it's so important at this stage to try to support our bodies as best we can. But it also can result in elevated cholesterol. It increases our cardiovascular risk and increase our risk of other chronic diseases as we go along. But we can actually avoid that and thrive through this stage. I also think that a lot of times now in menopause, we look at it as something pathologic, but it's not really pathologic, right? It's this life. It is biology. It's just, I find that sometimes our modern lives make it more pathologic than it needs to be. I mean, it's hard because we are, as we said earlier, as women, we're responsible for so many things, and we take on this stress and this idea of perfection, and that compounds those symptoms, I think, and the outcome, that stress and cortisol, HPA axis has a huge effect on how we go through this stage of life. So I think that managing stress is an even more important factor at this stage of life. And it's been shown, if we focus on managing stress and lowering our cortisol, that actually can help that transition be a little more gentle.
Yeah. Amazing. Okay. Yeah, that's really helpful. Thanks. That's helpful for people who are kind of just starting to go through this phase of life or just starting to think about it or realize, hey, something's changing here. Just feel a
Yeah,
little bit
and the other
empowered.
thing I want to say is that I think that this time of life, it's like a pause, and it's time to really like listen to our bodies more. And sometimes the feeling is that we have to try to stop it or change everything or try to hold on to how we were before. And it is a transition. And I think that our body is craving more. Like we need our digestion changes, our microbiome changes, and we actually need more nourishment, more attention, more care as
Yeah.
opposed to less, and I think that's an important factor as well.
Awesome. Awesome. So you talk about kind of transitioning a little bit, the different 6 pillars, right? So going through some that we haven't touched quite as much on, but sleep. We touched about sleep and stress, and that is a huge correlate. I think that's really common, especially for middle of the night insomnia, where we kind of wake up and have these thoughts that are ruminating. But even for sleep onset, can be a really important indicator for that too. Is there anything sleep recommendation wise or anything that you found that you've been able to talk to people about that was beneficial?
Yeah, sleep is important. One thing that we didn't talk about was cell phones, which is
Mm,
a big that I talk to my patients about a lot now. The cell phones, number one, increasing our anxiety and elevating that cortisol, which can be the reason that we're waking up in the middle of the night, but also the blue light, and that's one of the most important things is that limiting the blue light at least an hour before bed, ideally 2, maybe longer, because the blue light is the strongest, controller of our melatonin and our circadian rhythm. So when we expose ourselves to blue light before bed, it affects our melatonin secretion, and our bodies don't know what to do. And as that we may fall asleep initially, but then end up waking up because that melatonin isn't there to help regulate. But the wind down routine, I talk about that too. It's like the two ends of the day, right? So bookending the day, like starting the day in a calm state can help set the tone for the day. Ideally, getting exposed to daylight early in the morning kind of sets your circadian rhythm, turns off the melatonin, and sets you up for sleep at night. But that bedtime routine is really important too. Now, I have been guilty of this myself. It's like you run around all day, you do, you're responsible for everything, and then you just lay in bed and you're like, okay, I'm ready for bed. Your body's like, what? Wait, no, I'm not ready. I can't do it. So you really have to have, kind of bookmark, end your day, end your day, have like a wind down routine, whatever that involves. Maybe it's a little journaling, maybe it's a cup of tea, maybe it's a warm shower, warm bath, which also has other beneficial, setting your body temperature up for bedtime. Really, that wind down is important. So at least an hour before bed. Now my watch reminds me it's wind down time. So, like it's like time to wind down. But
Yeah.
it really is important. And the other big thing is keeping the same sleep wake time, which is I think, is a big one because we often feel like I'll just make up on my sleep later, right?
Yeah.
But that affects your circadian rhythm. So keeping that same, bedtime and wake time every day as close as you can, because
Yeah.
those are the two, I think, big things.
Yeah. There's a lot that you touch on there. Yeah, I had a lot of trouble with sleep for a while. And I think it really was that pattern. I would do 100 things during the day, right? And I was trying to manage so many different people and so many different aspects. And then I would just hop and I was like, great, time for bed. Let's get into bed. I want to make sure I get enough sleep. And I don't think our brains can do that, right? It's not an off switch, but definitely implementing a wind down routine. And I like kind of joke with some friends. I'm like, there's been so many benefits to having toddlers. And it like kind of like reminds you some things of how the human
Right.
body works. Like when a toddler drops a nap or something or like misses a nap, I mean, parents freak out, right? And they're like, man, they're going to be crazy for the rest of the day. Or it's going to be a little bit more challenging. And then same thing, like we have this whole wind down routine with toddlers and with our babies, and we read books, we take baths, we brush teeth, we get into pajamas and do all these things, and it helps them get ready for sleep. And people say when you travel, toddlers oftentimes have trouble sleeping in a new environment, and people will recommend, hey, do the whole bedtime routine, right? And it'll kind of help them adjust and understand, okay, this is what's coming. And I don't know that as we grow up, we lose all of that. There are just benefits. I think we have all of these signals within our bodies that tell us, well, what's going to happen next. And we are creatures of habit. And so we wake up and sometimes, we'll brush our teeth or make coffee or do something. And a lot of it just kind of happens autonomously once we get into these schedules and these habits. And the same thing we can do with sleep. We can kind of train our bodies to fall into that rhythm and make it much, much easier to fall asleep and stay asleep. So yeah, really, really important. And like you're saying, it affects everything. And when I talk to people about the different pillars and different habits that people can do for health, sleep is kind of the place that I start. Obviously, I love food and I love talking about food and so many other things, but I kind of tell people start with sleep, get your sleep
Yeah.
under control because it helps with everything else. It helps with mood. It helps with our ability to focus the next day to then get whatever task done that we want. And then we're going to set ourselves up for a lot more success, I think, if we can rest and rest well. So very cool.
Absolutely.
And then movement. Any
Movement.
thoughts
Yeah.
on movement? Yeah.
I mean, I think the most important movement is the movement you're going to do, really, when it comes down to it. I had
Yeah.
a patient last month who was like, I'm going to the gym. I try to go to the gym. I hate going to the gym, but I make myself go every day. And I'm like, if you hate it and you're doing it every day, that's just not good. So, yes, sometimes we have to do things that we don't enjoy, but generally it's like finding something that you enjoy. There's so many different options, whether it's walking or playing tennis or dancing or whatever it
Yeah.
is, find something that you enjoy to do that you're going to do.
Yeah. And the other thing that I like is integrating all of these things together, right? So social connection, we haven't talked as much about that, but that's another
Mhm.
huge piece of life. We're supposed to be with other people and we're supposed to enjoy
Absolutely.
life with other people.
Right.
And accountability partners is a really good way to get things done, but
Right.
find someone who you can work out with or enjoy a walk with or enjoy playing
Right.
tennis, a partner. And then you kind of get multiple pieces at the same time. And
Absolutely.
anything that you can do to integrate that, it makes life, I think, more enjoyable and just easier. So,
Definitely. That is so important.
yeah,
Connection and joy. Those are
connection
the
and joy.
two huge things. I mean, they really are.
Yeah. So when we start talking to people about integrating some of these lifestyle habits, how quickly do you see people notice a difference?
I mean, it can be within a week, it can
Yeah.
be pretty quickly. You may not see numbers change, but you see how you feel. You start to feel that right away. Definitely.
Yeah. Amazing. Is there anything that you want to touch on that we haven't really addressed quite yet?
No, I think we covered all of the gamut. I just want to stress how important I think joy is to the whole process, because it's hard to do any of these things unless you're finding enjoyment in life. I would say I think about, they give the example of the blue zones, and part of that
Mhm.
was part of my transition from the rigidity of, following all the rules to like how you really incorporate it into your life. I mean, you look at it, it's really the more that you're living for your purpose, you're living for the people around you, you're finding enjoyment in those day-to-day activities, the more likely you are to actually have lower stress, but also
Mhm.
be able to continue them for the long term. So, and that's really the whole point of life, right? Is
Mhm.
enjoying it and experiencing it fully.
Yeah. Yeah. Amazing. One other question that I have been asking. So when it comes to plant-based eating and then just eating, healthier, whatever you want to call that in general, there's another notion of cooking a little bit more or trying to prep a little bit more of what you're eating as opposed to just eating everything out. Um, is there anything that you particularly like to make or that you have found to help in that area?
So, I will say I'm not a great prepper, but I do find that there's a couple of things that I always have beans available in some sort, right? Beans or lentils. And I do, if I'm making something like a soup or a stew, I make a lot of it so that everybody can take some for the next day or a couple of days. That's a big
Yeah.
one. One of the favorite little quick things I've been making lately is this. It's a lentil and farro kind of mix with garlic. Love garlic and everything. You can't go wrong if you add garlic to anything. And herbs and spices. And like you can actually boil them together because they cook at the same time. And then you saute just
Nice.
a few herbs and spices, whatever your choice is. You throw that together. And that's you can make a ton of that. You can make,
Yeah.
it's like a cup to cup, boil it. And you can have that as a side with salads, with whatever to go for the week.
Awesome. Awesome. I've been getting into pasta lately.
I love
And
pasta.
yeah, it used to feel like it was such a arduous task, right? Or I would leave like an entire evening in order to make it. But I invested in the KitchenAid attachment.
Great.
And oh my gosh, it's been amazing. It's been so
Wow.
easy. So the
Good.
KitchenAid will, make the dough essentially, and then you can kind of just feed it through the attachment you want to let the dough rest for like 30 minutes. But after that, I mean, it's maybe another 15 minutes or so, and it's, like, done. And that's been really,
I
really
love
fun, and
fresh
also
pasta.
fun to get kids involved in, so if another social thing, right? If meal prepping or making food is just not on the docket or not something that you enjoy, then every now and then doing it with a friend or doing it with someone else, with kids if you have them, is another good way just to get people involved and to make it happen a little bit more.
Yes, absolutely. Yeah, I love those big, when you get together and everybody does a little bit kind of
Yeah.
dinners together. It's very fun. My daughter makes pasta. Oh, so good. I might have to make her make us some tonight. It's
No,
very good.
once you start eating that, same thing as the farm, right? Like, you really want the carrots from the farm, but man, the
Exactly.
pasta that you make at home, it tastes fantastic. So good, so good. And
Absolutely.
then there's so much that you can play with to make it more fun too, but yeah, really fun.
Great.
Awesome. It's been so fun chatting. Thank you so much.
Thank you for having me. This was a lot of fun. Really great
Yeah, there's
conversation.
so much
Thank you.
overlap, so many things that I think we're both doing that we're trying to, explain to the world. And again, I think the ultimate goal here is really just to help people live a vibrant life and to live a joyful life and to enjoy the day to day. And that kind of stems from having a healthier body, right? When we feel well, then we're able to exude a lot more. So thank you so much.
Thank you.
Thanks for tuning in to Dive into Health MD. Our goal is to empower you with knowledge to better understand how your daily choices influence your health. If you enjoyed this episode, consider sharing it and subscribing so you don't miss what's next. Please remember, this podcast is intended for educational purposes only and should not be considered medical advice. For personalized guidance, always consult your physician or a qualified healthcare professional. Wishing you physical, cognitive, and financial wealth. See you in the next episode.